should see improvement in a couple of weeks.
The heart failure unit at Dublin's St Vincent's Hospital is trialling this new system that allows consultants hold virtual consultations with up to 25 GPs, reducing patient waiting times by half and increasing GP education.
When you say her imaging, do you mean her echo in the first instance, or?
Yeah, I think if the trouble, as you know, with somebody with that degree of increased body mass may not echo very well. If she doesn't have claustrophobia, we might be better off doing an MRI, because what we'd be using the imaging for specifically here is to drive the need for an ICD.
In the last couple of weeks, I've had two patients that I've used the service for. One is a 92-year-old frail elderly lady in a nursing home who had sudden severe worsening uncontrolled heart failure, and I was worried about upping these doses and doing more because she's frail, she's got a bit of cognitive impairment, she could fall, she has diabetes. So I got onto the virtual clinic. I spoke with Ken, and he suggested that she was probably, her gut was congested. He suggested put her on a small dose of a thiazide-like diuretic. Well, we did that. We did that last week. The edema has reduced, the transudate from her legs has stopped. So for this frail elderly lady, this saved a hospital admission. She probably would have deconditioned and ended up with other problems. So I think that's one example where this virtual clinic has actually saved the state an admission to the hospital.
The format of the consult is very clever in that you have a CME presentation at the start, which focuses on a new area, so try to improve education. And then the opportunity to present your case to Ken, and I suppose a sense of partnership too, that you're discussing and feeding back, and he's bouncing off us as well and trying to clarify. And so it's a hugely enjoyable and beneficial experience, certainly from my point of view.
From talking to the patients themselves, what they find is that this idea that their GP can discuss their case with a specialist team and then feed back that information to them without them having to travel the outpatients is very reassuring. It's very convenient for them and their families, and it really makes them feel safe, I think is a word that they often use, that they are still within a healthcare system that's connected up and looking after them, and that even if they do end up in hospital, that their information is still there and they still are known to that heart failure team.
It brings specialist care closer to the person who needs it, rather than to go the other way around, and it eases up pressure on outpatients, so it's the obvious way to go.
I think text care is a really innovative idea which combines the idea of providing acute care, at least initially in a local fashion, providing diagnostics in the community to help triage patients to the most appropriate stream of care, and then ensuring that they get high quality specialist care rapidly.
I would see the use of electronic media, including the virtual clinic, as being a natural progression